Imagine going in for a routine checkup and walking out with a diagnosis that changes your life forever. But what if that diagnosis was never going to harm you in the first place? What if the test did more damage than the disease ever could? In today's video, we're diving into 7 medical checkups that you may want to avoid after 60, because sometimes the search for problems creates more problems. If you're over 60 or care for someone who is, this might be the most important health video you'll watch this year. Let's reveal the silent dangers of overtesting and what to do instead. Welcome to Health Pulse Haven, your safe space for science-backed senior health. Today, we reveal 7 health tests you should think twice about after 60, because less can sometimes mean more when it comes to your well-being. You've probably seen the ads: get a full-body scan, catch silent diseases early. Sounds reassuring, right? But here's the truth. Full-body scans, especially CT scans, can pick up tiny, harmless findings, like cysts, nodules, or calcifications, that aren't cancer but look suspicious. This leads to biopsies, follow-ups, anxiety, and even risky surgeries, all for something that never needed treatment. CT scans also expose you to high doses of radiation, which, ironically, can increase cancer risk. What to do instead? Ask, is this test based on symptoms or just fear? Stick to targeted scans only when symptoms suggest a real need. The PSA test screens for prostate cancer. And while early detection sounds good, most prostate cancers in older men are slow-growing and harmless. But once detected, they're often treated aggressively, with surgery or radiation that can lead to incontinence, erectile dysfunction, or infections. Medical guidelines now advise against routine PSA screening after 70, unless there are symptoms or high genetic risk. What to do instead? Monitor urinary symptoms, maintain a healthy diet, and discuss individualized screening plans with your doctor. Colonoscopy is crucial in your 50s and 60s, but after 75, the risk-benefit balance flips. Sedation, bowel prep, and even bowel perforation become significant risks, especially in people with heart or kidney issues. And if your last tests were clean, your chance of finding serious disease now is low. What to do instead? Ask about less invasive options like FIT, fecal immunochemical test, or skipping entirely if your risk is low. Here's the scary part. Many seniors suffer not from disease itself, but from chasing ghosts that modern scans pick up. Overdiagnosis is the epidemic no one talks about. It's time we start making smarter, not just more medical decisions. Stay with us, because the next 4 tests could save you from unnecessary pain, panic, and even permanent harm. You feel fine. No lump, no fatigue, no abnormal blood work, but your doctor orders a neck ultrasound anyway. Result: tiny nodules are found. Most are benign, but now you're booked for a biopsy. A few weeks later, surgery. Now you're on lifelong thyroid medication. Unnecessary thyroid scans are a leading cause of overtreatment in seniors. What to do instead? Only scan when symptoms or abnormal blood tests suggest a real thyroid issue. Cardiac stress tests are helpful, but only when there are symptoms or high-risk factors. Otherwise, these tests can show false positives that lead to angiograms, stents, or even bypass surgeries for blockages that never needed fixing. These procedures carry their own risks: bleeding, infection, heart damage. What to do instead? Focus on controlling cholesterol, blood pressure, and blood sugar. No symptoms? No test. Bone density testing is important, but repeating it every year? Not necessary. If your bone health is stable and you're already on treatment or have no fracture history, testing more than every 2 to 3 years doesn't help. What to do instead? Focus on strength training, vitamin D, calcium, and fall prevention. Cancer screenings like mammograms, pap smears, or lung CT scans might seem proactive. But if someone has limited life expectancy, the benefits may never materialize. The test might find a cancer that would never cause symptoms, but the treatment might shorten life or worsen quality. What to do instead? Discuss life expectancy, quality of life, and personal goals before agreeing to routine screenings. Let's recap the 7 health checkups you may want to avoid or rethink after 60. 1. Full-body CT or MRI scans without symptoms. 2. PSA screening in older men. 3. Colonoscopy after 75. 4. Thyroid ultrasound without abnormal TSH. 5. Stress tests without heart symptoms. 6. Frequent bone density tests. 7. Cancer screenings with limited life expectancy. Being proactive about health doesn't always mean doing more. Sometimes it means doing what's right for your unique body. Talk to your doctor. Ask questions. Challenge unnecessary tests. And remember, your health is a marathon, not a scan result. If you found this video helpful, hit like, subscribe, and share it with a loved one. Let's make smarter choices together. Thanks for watching Health Pulse Haven, where science meets self-care every step of the way.